Story 1. When I was in my mid-20s, my pap smear came back abnormal and tested positive for human papillomavirus. I begged, literally begged, my male obstetrician gynecologist for a colposcopy, even said I would pay the full amount up front in cash if insurance denied it. He initially said no, so I kept making appointments with him to ask more questions about what would happen if it was cancer and it wasn't caught in time. Finally, he gave in and did the colposcopy, but, get this, did not get clear margins and had to repeat it. The biopsy results of the second colposcopy showed that the outer edge of the sample tested positive for cervical intraepithelial neoplasia grade 3, precancerous. After he gave me my results, he had the audacity to say, "I guess sometimes you have to listen to your patients." I then asked him for a loop electrosurgical excision procedure. Story 2. I had to be held down by two nurses while they biopsied my cervix and uterus without pain medication. I was screaming and told, "You're fine. There are no pain receptors there." I was given nothing. I was scoffed at. I drove myself home, and my dad said that he had a biopsy on his nose last week, and they had given him pain medication. Story 3. I spent the majority of my life believing I have a gastrointestinal issue because that's what the doctors told me the pain in my left side was. Then it got worse, more frequent, and more painful. It felt like someone was cutting out my abdomen with a hot knife. I had 3 colonoscopies and an endoscopy that came back normal. I had urinary tract infections so frequently that, towards the end, I didn't have any symptoms until it spread to my kidneys. I was on the verge of sepsis once and hospitalized for 36 hours. Because of this, I went to a urologist who then sent me in for a computed tomography scan. On the follow-up, he said, "I think it's just better if I turn my screen around before explaining." Sure enough, there was a bright white, egg-shaped mass with a bean-shaped shadow squished around it. My first thought was cancer, but it was a kidney stone. He told me that in his 20 years of practicing, he has never seen one as big as mine. It was large enough that it was putting pressure on my kidney, causing the pain I was having. I had it removed in December of 2023 at 21 years old. I've been having pain and urinary tract infection issues since I was 8 or 9. That's how long I was misled into believing my searing pain was just gas or irritable bowel syndrome. I haven't had a urinary tract infection or any pain in my side since. Story 4. Went in for pain in my shoulder. The doctor said I was just getting older and these things happen. I went to another doctor and it turned out I had a nearly baseball-sized non-cancerous mass that needed to be removed. The way I was just passed off still makes me mad. Story 5. Had 2 colposcopies with no pain medications or even a warning about what was going to happen the first time. However, a nurse assistant came in with the doctor during the first procedure and started talking to me about her boyfriend and her thoughts about school. While I was wondering why she kept talking to me about such casual stuff, I felt the first pinch and was like, "Ouch, that really hurt." The nurse assistant took my hand and started asking me questions about my life, and I understood she was distracting me on purpose, so I played along. The second colposcopy was done with a different doctor at a different office, and there was nothing of the sort. They just went in and coldly cut into my cervix as if it were nothing, and when I told the doctor about how well I was treated at the first office, he shrugged. No one cared. Farm animals are treated better. Women don't feel pain in their cervixes. Story 6. I went to a gynecologist about my premenstrual dysphoric disorder. She told me it was normal to feel suicidal before a period. She also told me that birth control may help, but that I would have to go to a different gynecologist for it because she was Catholic and did not feel comfortable giving it to me in case I used it for birth control. I reported her. Story 7. I've never wanted children. It's just not for me. I started trying to get my tubes tied when I was 21 but kept being told that I might change my mind. I was finally able to get it done when I was 37. While I was being prepped for my surgery, a nurse started talking to me. She asks me how many kids my husband and I already have. I told her none. She then confirms that I am getting a bilateral salpingectomy done, and I say yes. She goes, "If you have no kids, what does your husband think of the surgery?" I told her if he wanted kids, he wouldn't be my husband, as I was very selective in choosing a partner who also didn't want kids and would support the choices I made for my body. Story 8. I went to see a male gynecologist for what I thought was a uterine prolapse after my third baby. He was the only one available, so I felt like I had no choice. He accurately diagnosed me with a stage 1 bladder prolapse, but said there was nothing I could do about it. I pushed back because I wanted to fix it, and he responded with, "What are you so worried about? I've seen women living their lives with their entire uterus or bladder hanging outside of their body. You're not going to die from this." As soon as I got home, I searched for a pelvic floor physical therapist and scheduled a call with her that day. She confirmed my doctor was right in my diagnosis, but was wrong in saying there's nothing I can do to fix it. After 6 months with the physical therapist, I completely healed my body, out of pocket but still so worth it. Story 9. A male gynecologist charged me $225 to tell me that I was too young for breast cancer. He poked my breasts for 2 seconds, told me to drink dark beer, and also tried to talk me into a pelvic exam. To be fair, I was overdue for one, but I was not about to let him do it. I got an ultrasound anyway after going to my primary care physician, who is amazing, and ended up getting a mass removed from my left breast the size of a golf ball. Story 10. I complained for years that my periods were not normal. They lasted 8 to 10 days. I had to wear tampons and pads and eventually resorted to adult diapers due to heavy flow. Sometimes I would get periods twice in 1 month. Other times I would not get a period for more than 6 months. The pain was so severe I would miss school and work. I would bloat to the point of looking 6 months pregnant and more. I was told, "Welcome to womanhood." It turns out I have polycystic ovary syndrome. Story 11. Does mental health count? I was seeing a therapist and talked to him about my situation. He told me, "At least you probably enjoyed it, right?" He treated me more like a colleague, would flirt with me, and also kept trying to set me up with his son. I stopped going to him and didn't realize just how bad the situation was until afterward. Story 12. My back hurts. Sometimes I can't find a comfortable position. Full body spasms, pain level beyond measure. Can't lift or feel my legs except for a pain that feels like I'm lying on top of a livestock fence while trying to prolapse my spine through my pelvis. Oh yeah, and if I move certain ways, I lose control of my bladder. Background. I've been experiencing this pain since I was 16. I'm currently 44. I used to be a hardcore equestrian who was once heavily involved with training questionable beasts. Some of them even fell out from under me. I also used to hike hundreds of miles a year and have participated in 5-kilometer races and events like Warrior Dash. I'm not a hardcore athlete, but I love my gym time, outdoor activities, and being active. Over the past several decades, I have heard the following statements from qualified, recommended medical doctors. Back pain doesn't cause leg numbness. Riding horses is not a physical activity, so falling off a horse cannot be considered a traumatic injury. I need to eat less bread and more meat or go keto. I can't digest meat, so no. I am hysterical, and my back won't stop hurting until I calm down. I need to get used to the pain. Family history has no bearing on bone or spine conditions. My father has had over 40 spinal surgeries due to what he was told is a genetic problem with his bones. It doesn't hurt that much. Lie in bed and use a container for a bathroom. I am too overweight to hike and run, so I shouldn't do these things anyway. I am too overweight to ride horses, so it's a good thing I can't now. I am a coward. I need to go get ice cream with my husband. I need to calm down. I need to stop eating bread entirely. Back pain cannot be debilitating. I should be able to put weight on my right leg, just try it. You cannot feel increased pain when lying down. That weird spasm thing my back is doing shouldn't be happening. Therefore, I am supposed to ignore it even though sometimes I end up on the floor. A bulging disc isn't a big deal. Plenty of people have a spinal cord impingement and don't complain about it. I haven't slept through the night all year, and sometimes the pain is so bad I vomit. But there's no circumstance under which it isn't my fault. It's just so futile. Story 13. About 3 years ago, I called and inquired about abortion at my gynecologist's office and what available options there were for women considering getting one. The receptionist, office worker, whoever it was, promptly told me abortion is illegal in Pennsylvania. I said, "No, it's not." And she insisted it was. She was super condescending. Newsflash. Abortion was and still is very much legal in Pennsylvania. I called back, reported the worker, demanded to speak to my gynecologist, and received profuse apologies. I promptly switched providers and made it known that they have workers who knowingly give false information. It's one thing if you don't believe in it, but another when you work in women's healthcare and intentionally misguide women looking for help. Story 14. The blank look on my doctor's face when I told her I want to know why my period is suddenly changing in my mid-30s, rather than just randomly choosing a different birth control. The next doctor I saw about it immediately scheduled me for an exam, an ultrasound, and a blood test. We found out I am perimenopausal, which saved me years of worrying about why my periods were 45 days apart last month and 12 days apart this month. Story 15. In my mid-20s, I started bleeding and just didn't stop, so I went to a new gynecologist. I was living in a small town, so there weren't many options. The first thing he did was prescribe me a triple dosage of the pill after I told him I couldn't take hormonal birth control due to family history. He insisted, so I did. At my follow-up a month later, I was still bleeding. He did a manual exam and then told me he would be right back. No nurse was present, and I didn't know at the time to demand one. He came back with this old-looking machine, turned it on, and told me to relax. He proceeded with dilation and curettage. No warning and no pain management. The machine was vacuum suction. After he was done, he held up this glass tube, full of whatever he removed from me, and said, "Huh, I think you might have been pregnant." Oh well. I drove home alone after that and didn't see another gynecologist for about 11 years. Story 16. I went to my primary doctor with extreme abdominal pain that ranged from a pain scale of 5 to 10, lower back pain which was not normal for me as an everyday stretcher, and heavy vaginal bleeding for 2 weeks past my regular period. No ultrasound was done even though I requested one. I also requested to see my gynecologist, who was in the same building, but was told no to both requests and diagnosed with an ulcer from stress, as I was planning my wedding at the time. I took ulcer medication for 3 weeks with no improvement. I made an appointment with my gynecologist. She did an ultrasound and immediately had me go to the hospital for an intravaginal ultrasound that took 1 hour, and then I was admitted. Severely septic ectopic pregnancy, lost my right fallopian tube and right ovary. Surgery and 3 transfusions later. Story 17. I've got 2 stories. Me, age 20, sitting in a paper gown on the exam table for half an hour waiting for the best obstetrician gynecologist in town. Suddenly, the doctor slams into the room, slaps my back, and says, "Don't slouch," and carries on with the exam. The speculum was metal, not warmed or lubricated. When I jerked, he laughed. When that was done, I told him I thought I was depressed, and he said, "You're too young to be depressed." My daughter, 15, who's had excruciating 2-week periods, like the ones that make you vomit, finally consents to be examined. I schedule an appointment for her with a highly respected doctor at a teaching hospital. She had been sexually molested earlier in life, and I wanted her to see the best of the best. We meet in his office. She tells him her story. She wanted me for moral support, and he said, "Have you tried ibuprofen?" I stood up and said, "Thank you for your time," and we left. I got an appointment for her at Planned Parenthood, and they were so respectful and kind. Turns out she has endometriosis. They put her on the pill, and she had laparoscopic surgery, and 6 years later, she's doing well and can function all month. Story 18. Went in for severe period bleeding and pain. Had a heavy flow for over a month. Saw a male doctor who said sometimes a period lasts longer than a few days. Like no surprise, but over a month? Told me I needed to lose weight and then my periods would be normal. Went to a female doctor after for a second opinion, and it turns out I had uterine fibroids that needed to be removed and was diagnosed with polycystic ovary syndrome at the same time, so that was fun. Story 19. I have had Crohn's disease for many years and have had several major surgeries and intensive care unit stays. I had a female doctor look at an X-ray that was taken after all of that and say I had never had Crohn's because she couldn't see it on an X-ray that was just taken. Needless to say, I never went near her again. Story 20. It was a long time ago, so I've made my peace with it, but when I had a miscarriage, the appointment was in the maternity section of the hospital. I sat in a waiting room with congratulatory baby items, surrounded by joyful new parents. As I waited to find out if I needed a non-viable fetus removed, they told me to buy my own pregnancy test when I got home to check if my hormones had returned to normal. I did not do that because it felt absolutely heartless, so I still don't really know if everything went the way it should. When I complained, they replied saying that there was an extra entrance for the pregnancies that had complications, which, as far as I can tell, wasn't even true. 3 walls of the waiting room were just walls with no entrances, and the other wall was open to the maternity area. I checked the hospital site map, and there's only one entrance. Instead of apologizing or considering how they're treating women who are losing babies, they just misled me about the hospital layout.